Hey everybody, this is Dennis from Lindsay Jones, and I'm driving along. I wanted to tell you something, but of course I'm going to pull over here because I'm not supposed to be doing video and driving at the same time, especially at my age. I'll probably crash into somebody. But anyway, hey, I wanted to just tell you a quick story. Recently I was asked to maybe help bring respiratory therapists to Honduras. And in Honduras, they're having a massive shortage in all kinds of healthcare workers, and they don't use respiratory therapists here. And as I was talking to somebody really high level that's working on that, they were asking if we would help create the courses that would educate doctors and other hospital staff in Honduras what a respiratory therapist really was. Anyways, I was talking to them, I realized I was describing that we do a lot more than respiratory. We also do cardiopulmonary things throughout the hospital. It's very, very interesting, but just to give you an idea how short they are over there, the person I was talking to was a nurse, and she was saying that she was by a patient, and the patient kept going into a cardiac rhythm that was deadly. And so she basically had to stay by the patient to get them back out of that rhythm to treat them, but he kept going back into the rhythm, and she stayed there, and they were so short that no one could come replace her. And so she stayed there for another shift and another shift until finally she was just absolutely exhausted, and she had to leave. She had to leave and go home. And then of course when she came back on her next shift, the patient had passed away. Why? Because there was no one there to take care of them. So as we think about putting respiratory therapists, we might call them respiratory therapists there, or cardiopulmonary therapists. As we think about that, what's interesting is that we might increase the scope of practice of what a respiratory therapist does in Honduras. Because if there's no one there to treat them, then the therapist may need to do a lot more than just respiratory therapy. So pretty cool evolution that's going on in the world. Comment in there and let me know what you think, and let me know if you want to go to Honduras and help me bring respiratory therapy there. Anyway, we'll talk to you later.